There's a lot of continuing education companies providing opportunities to learn trigger point dry needling, but the science behind trigger points is a little bit murkier. They've traditionally been defined as a hyper-irritable band within a muscle that's essentially created a spasming that persists for an undetermined amount of time. And there's criteria to find that, which would be a taut band in the muscle, referred pain, localized tenderness, all this sort of stuff. But when we actually look at the literature on defining and assessing for trigger points, we find out that our reliability is not very good. To date, there hasn't really been any imaging studies to prove that they exist, that we can see them, that we can find them on MRIs or X-rays or CT scans or anything like that. So the evidence is a little bit murky on whether they exist or not, which calls into question a treatment that you might use focused at trigger points, which would be trigger point dry needling. It's a little bit of an iffy subject, and a lot of people are personally invested in it. There's a lot of what you would call the sunk cost fallacy. It's difficult for people to take a step back and explore what they believe or what they've learned if they've spent a lot of time or money investing in learning about a specific approach or a specific condition. So sometimes it creates some controversy and some uncomfortable conversations. That's another big area of controversy. In my personal biased opinion, I think that you can compare the two somewhat equivocally because they both introduce a thin monofilament needle into the body through penetration of the skin. If we just look at the word acupuncture, the Latin breakdown, it is needle penetration through skin, right? So dry needling is essentially the same thing, but it's been retermed where we push a thin monofilament needle that doesn't have any sort of substance to inject into the human body into certain areas to try to treat pain or dysfunction. The big difference between the two is philosophy and not necessarily the technique or the tools themselves. So an acupuncture philosophy, given there's many different types of acupuncture, but the most well-known is traditional Chinese acupuncture, functions on the theoretical basis of meridians within the body and yin and yang energies and impaired energy flows within the body. So acupuncturists function under the idea that they can insert needles into certain predetermined points in the body that would either facilitate or inhibit the flow of energy to different areas, whereas somebody practicing dry needling would focus specifically on the musculoskeletal system in the way that they approach the treatment. However, if you take away the rhetoric behind the two, the treatment is essentially identical because it has the same tools and is doing the same mechanism of treatment. That's a difficult question. It's an ethical conundrum because in certain cases, dry needling may be a less invasive form of treatment that could get a person to buy in and perceive that they have an improved ability to heal or to get better or get over their injury that maybe isn't as risky as surgery or certain medications, especially with the opioid epidemic going on right now and that sort of thing. So I think that under that lens, I could recommend it. However, under the lens of its actual effectiveness when controlled to sham treatments, we can't say that it's any better than placebo. However, eliciting a meaning response in a person that improves their subjective symptoms and at least decreases the likelihood of them seeking more invasive or possibly more risky procedures, it could be recommended. However, it's an ethical debate and there's people that stand on both sides of that line.